Hi, I'm Dr. James Machino, and I want to talk to you about natural remedies to manage PMS. You know that premenstrual syndrome, or PMS, affects a lot of women. About 7 to 14 days before menstrual flow starts, a cluster of symptoms can sort of seem to come out of nowhere, actually. And sometimes women will also have menstrual cramps, or what's called dysmenorrhea, very painful menstruation with a lot of cramping from the uterine area. And the prevalence, it's quite a significant prevalence. About 1/3 of women who are premenopausal have some PMS symptoms, and it's especially prevalent, or the symptoms seem to be most severe when women are between the ages of 25 and 40, and about 10% of women have very severe, almost debilitating symptoms of PMS. And so the symptoms manifest in a number of different ways, of course. There can be emotional symptoms where you feel depressed, or there's anxiety, irritability, mood swings, nervousness. There can be intestinal symptoms, bloating, food cravings, sugar, chocolate, changes in bowel habits, constipation, diarrhea. Reproductive symptoms are common with reproductive tissue, breast swelling, breast tenderness, uterine cramps, changes in libido. And other physical manifestations, headaches can show up at this time of the month. A nagging backache, which can linger for days. And also swelling of the extremities, fingers, ankles, not uncommon. So that any combination of these symptoms can show up, as you know, and make life a little bit less than enjoyable. So what's causing this is the question. The most consistent finding in PMS is that there's a high estrogen to low progesterone ratio. That imbalance of estrogen and progesterone seems to account for a lot of the symptoms. How does that happen? Well, just from certain dietary behaviors that are faulty, you can raise estrogen levels too high, or the liver's not detoxifying the old estrogens in a timely fashion, and so estrogen builds up. Or there can be sort of ovarian failure where the ovaries are not producing enough progesterone, so it creates this significant imbalance between the two hormones. But it's the impact of estrogen and progesterone that's most striking. And it has an effect on a number of tissues. That imbalance then affects the brain, and endorphin levels drop down, which can lead to mood swings and depression and anxiety. A lot of the emotional things can come from a drop in endorphin levels in the brain, secondary to the estrogen-progesterone imbalance. Also, that imbalance can lead to an increased secretion of prolactin, which can cause breast pain and breast tenderness, and even aggravate fibrocystic breast disease. And the high estrogen level often increases the release of aldosterone, which causes the body to hold water and sodium in the body, so you get the bloating and the swelling and some of the other very uncomfortable symptoms. So the medical treatments that are available, and I don't like any of them, is they'll give women, the birth control pill to try to override all of her own natural hormone secretions, or other hormones that will block the ovulatory cycle. Or they'll use antidepressants if there's emotional symptoms, anti-anxiety drugs, diuretic drugs to wash out the water and the salt, painkillers to take care of the breast tenderness, or muscle relaxants to help get rid of some of the uterine cramps. I'm not saying you can't use these things, but the reality is that in most cases, using the right nutrition, lifestyle, and supplementation approach, you can actually get everything back into balance naturally and sort of curtail many of the symptoms. So what are the natural remedies that have been proven to work in human clinical studies, so that you don't go off, on a wild goose chase trying things that are not going to get you results? The things that have been proven to work with humans is a low-fat, high-fiber diet, the right dosage and standardized grade of black cohosh, soy isoflavones, and I like to include gamma or rosinol as well, which comes from rice bran oil. Dosages of vitamin B6 with magnesium, as well as vitamin E supplementation, and also the right dosage of calcium. And then also not smoking, watching your caffeine and alcohol intake, a couple of weeks before menstruation. And certain stress management things have also been shown to be helpful. When you put all of that together, you have a comprehensive strategy. So it sounds like a lot, but it's really not that difficult. What I've done is I've put all of that together into an ebook called The Natural Management of PMS, which you can download right here at this site, and I recommend that you do that. It shows you the right dosage and standardized grade of all the nutrients to use, exactly how to apply this so you can get the best possible result. Most medical doctors haven't studied much nutrition or natural medicine to even see these studies, and so they often are not going to mention that during a medical consultation. But it's important that you know that this evidence is available, because using natural interventions are safe and non-toxic, and I like them over having to use any of the drug or synthetic drugs that are often used, because they all have some side effects. So I would recommend, if you have any PMS symptoms at all and you're looking for a natural route to go, the best evidence is right in that ebook called The Natural Management of PMS, and you should download it right now. Now at machinohealth.com you'll see other research review papers and videos that I've created, footage from my live professional seminars, as well as other resources and downloads that I've created. They're there for free to help you lead a long, healthy, functional life, not just to be alive, but to be functional and vibrant as the years go by. All my research papers and teaching materials have all the scientific references in them, so you know you're getting only evidence-based information on any topic that you're looking for. So you really should make machinohealth.com an ongoing, reliable resource of health and wellness information for both you and your family members. Thanks so much for watching.